Hello, my name is Dwayne Kimball, owner and founder of KMD 89, a VA claims consultant, Leave No Vet Behind, and also I'm a United States Army veteran. Today, I'm joined today by a fellow veteran, a Marine veteran, Dr. Garcia. How you doing today, Dr. Garcia?
Hey, Dwayne, thanks for having me on, man. I'm doing great over here. Thanks for asking.
Yeah, I really appreciate you taking the time out of your busy schedule to do this interview for us today. And today we're going to be discussing PTSD stressors, the DSM-5, and the VA's DBQs and things of that nature. So definitely, again, really appreciate you doing this because I'm pretty sure a lot of veterans is going to see this on my YouTube channel, is going to find this information very beneficial. Okay.
Yeah.
So first question, define PTSD for us.
Yeah. Yeah. Well, Dwayne, you mentioned the DSM-5. I think it's a good idea to start there and give people a little bit of a background. So this is it here, right? The DSM-5. And what the DSM-5 is the Diagnostic Manual for Mental Health Disorders. Now, this book here is what therapists, psychologists, clinicians use, nurses, right, within our field to identify and categorize different mental health disorders. So your depression, your anxiety, and obviously PTSD falls under mental health disorder, right? So, I mean, let's just crack the book open and see exactly what it is that a doctor sees, right? Like how they identify, the symptoms and what those criteria are to meet PTSD. Overarching, the basic simple definition for PTSD is when someone has experienced a traumatic event or traumatic stressor, which has overtaxed their mental or psychological capacity to cope, right? Because they've been exposed to or have witnessed a traumatic event, okay? Now, as a result of having witnessed or been exposed to that traumatic event, we start to experience symptoms, okay? Mental health symptoms. So it could be depression, it could be panic, it could be flashbacks. And so we'll talk a little bit about what some of those particular items are. But here's post-traumatic stress disorder per the DSM-5, Dwayne. The first criteria is the exposure or actual threat of death or serious injury, right? Now that's pretty broad, right? Now for us veterans, we often, our mind immediately goes to like a combat experience that we've had, right? A lot of people might think of sexual assault as trauma. But the way it's delineated here, you can be either directly exposed to that trauma, have learned about that trauma. And what that means is, like, if you think of your 911 operators, for example, they can get PTSD from being on the phone, just hearing about all of the traumatic events out there. Experiencing the trauma yourself or watching it happen. So you might be standing on a street corner, see a really bad car accident happen. You can get PTSD from that as well. Right? So it's not just that something physically might have happened to you, but even if you felt the threat of a serious injury, that can be considered PTSD. So that's the first criteria. If there's a checkbox there, meaning anytime we've experienced something traumatic, we fit that first criteria for a clinical diagnosis of PTSD. Does that make sense?
Yes, it does.
Yeah.
And you were dead on because, I talk to so many veterans on a daily basis. And he'll say, hey, I got treatment here and I got treatment there. And I was diagnosed, with PTSD. And I was, when I first started learning, I learned about DSM-5 back in college, but I wasn't I took it, as a summer class, so you're more versed in it than I am. But veterans, we don't understand the difference between subjective and objective. So as you talk about the DSM-5 and, you use the example of the 911 operator, explain to the veterans, from a psychological standpoint, when you're, maybe trying to, when you're going through the DSM-5 and you see, okay, the patient has a diagnosis of PTSD.
Mm-hmm.
Explain what's subjective and objective, and how does that play a role in you confirming a diagnosis of PTSD per the DSM-5?
Sure. So some of it, and a lot of the things in here, Dwayne, in some ways are subjective because it requires the patient to self-report, to sort of look inward and say, like, hey, these are things I'm experiencing. For instance, I am experiencing anxiety attacks, right? Now, subjective, that could mean that the person is experiencing a great deal of distress or worry. And that might be in a social setting, that might be at home. The more objective, and this is again just using like panic attacks and anxiety, we'll come back to the PTSD, but objective measures are things that we can concretely measure. So maybe my palms are sweaty, right? Maybe I'm continuously looking around the room because I'm feeling a sense of fear. I feel my heart racing. I'm having actual nightmares. Like, that's all objective data. Those are things that we can objectively see with our own eyes and say that can be a symptom of, whatever diagnosis we might be looking at. Right. When it comes to PTSD, some of the subjective, which is again me describing what the depression feels like to me, I might say to you, Dwayne, I'm feeling a lack of motivation. Well, how do we measure that? That's not really objective. But if you're telling me, 3 days out of 5 days out of the week, I'm having a really hard time getting out of bed. I'm having a hard time wanting to take a shower. I'm not eating as much as I used to because I just don't feel like I have the energy for it. That's all very objective data that's telling me, okay, this isn't within the normal range of social functioning for this person. So that's objective data. That's saying there is a deviation from this person's normal state of functioning. Does that make sense?
Yes, it does. Yes, it does. So let's sort of stay on that topic, but shift it over to the VA's DBQs, disability benefit questionnaires. I know you have some experience with those over the past couple of years. And I know on the DBQ, it states the disability benefit questionnaire needs to be completed per the DSM-5. Can you explain that in some of, just as, the past year and a half, 2 years, your experience with that?
So super easy. Essentially is saying we're using this diagnostic manual, the criteria, the check boxes on the DSM. So if they're meeting the check boxes, and I'll talk about what those check boxes are, right? If they meet the criteria, if you can check the boxes off that say this is what PTSD is, then that lets us know this person can be clinically diagnosed with post-traumatic stress disorder, right? So what are those check boxes? That first one was that they actually experienced a traumatic event, right? Another checkbox is, are they experiencing an emotional disturbance as a result? Now, that's a very loose term, but are you experiencing depression? Are you experiencing panic attacks? Are you experiencing anxiety? Are you experiencing sadness, right? Those are all, like, if you have a mood disturbance, that's another checkbox. Suicidality, right? Are you having thoughts that it might be better for you to not be alive anymore? That's a checkbox. Are you having what they call sort of re-experiencing symptoms? So maybe you are finding yourself having flashbacks, which is sort of an older term that was used. Maybe you hear a loud bang from a car that's driving next to you and you think you're back in that traumatic event. Those are called re-experiencing symptoms, right? Flashbacks is sort of the general lay term for that. Avoidance symptoms are also a part of that, Dwayne. So do I tend to avoid people, places, or situations that remind me of that traumatic event, right? So maybe I don't talk to any of my buddies from the service anymore, because when I do, it triggers my memories of, when we were in Fallujah, or when we were, whatever that may be. Or I don't go outside the house anymore because driving reminds me of, a buddy of mine that got, blown up with a field mine, whatever that may be. So re-experiencing avoidance symptoms, if the veteran can check off these boxes based on what is going on for them, right? That's how they meet that diagnosis.
Okay. Now let's go back to the first thing you said, veteran experiencing a traumatic event. So
Yes.
as a mental health professional that's familiar with the VA's DBQs, if someone comes in, how does one, well, let me rephrase that. In order for you to check that box as a mental health professional, did the veteran experience a traumatic event?
Yeah.
There needs to be I'm sure there needs to be some type of objective evidence for you to review to check that box on the DBQ, correct?
Right. I mean, the objective evidence, right, is like, was this person deployed to in combat,
Right.
or right? Is there evidence of like having been sexually assaulted? But here's the thing with mental health, Dwayne, that's a little bit different than the medical field, the medical model which we are used to.
Mm-hmm.
You can't come into my office and I take your blood pressure and do some blood work, maybe a urinalysis, and tell you, yes, you have depression. Most mental health diagnoses are based on subjective measures, meaning I have to trust that you are telling me that as a result of that event, you felt threatened, or you were injured, or you felt that it impacted you in a significant way. Right. So I'm not there to judge, I don't know about you, I'm not a big dog person, right? But like, let's say we're walking down the street and somebody's walking on the other side of the street with a big Rottweiler, a big scary dog, and it gets off the leash and it comes at us, Dwayne, right? Mm-hmm. Maybe I don't know, you're a bigger guy than me, you work out, you look at this thing and you're like, you better back down. And maybe I'm running the other way. Now, who's to say that I felt threatened and you did it? Like, that's on our account. What we report, it felt like to us. Right. So this is important for veterans to know, because if they're feeling overwhelmed by these symptoms, they're able to report them. They might be able to get this diagnosis.
Right. And the reason why I brought that up is because the VA, they have those boxes too. And one of the things that I educate veterans on, they'll say, hey, I went to the VA and was getting treatment and they diagnosed me with PTSD, just as the way you explain it. They explain their situation, and that's on the healthcare side. But on the benefit side of the VA, they want to see, it has to be what they call a confirmed stressor. So you gave an example, the person served in, a forward area like either Vietnam or Southwest Asia. That can be confirmed in, personnel records on the DD-214. And then I think the later part of that, the second half is coming in and explaining that. So especially for filling out the DBQ, they have to say, well, yeah, they were in Southwest Asia, but from a mental health standpoint, psychiatrists or psychologists doing the exam, yes, they're getting, like you were giving all the examples and the symptoms, and then the VA, the adjudicators, they're looking, okay, well, veterans in Southwest Asia, we have to go in and confirm that was there. I talked to so many veterans, and I think that's the piece, those two pieces that you explained, that's the disconnect. They'll say, oh, I got a diagnosis at a VA hospital. And they say, well, I'm going to go on the VBA side and file a claim. And it doesn't always correlate that way, but just.
And part of it too, Dwayne, there are other measures, right? So like when veterans come through my office, I have some questionnaires that they fill out, right? That are asking not like, do you have PTSD, but like, what's your sleep like? What's your appetite like, right? Because these are all factors that can indicate something going on from a mental health perspective, right? What's your energy levels like? What, are you having thoughts of suicide? Are you able to take care of yourself financially? Are you showering every day? And as part of that, there's a clinical interview too. So like, I don't just want you to fill out those boxes. I'm going to have a conversation with you of like, tell me about your experience in the military.
Right.
What was that like? Oh, you were deployed. Tell me about that deployment. What was that deployment like? What were the things that you experienced, right? And through that level of assessment, I can gather like, okay, based on the information this person has given me, this seems like a highly traumatic or an event that felt significantly threatening to that person. And we can draw a correlation based on, right, like our training and our credentials that say, yes, based on what this person is telling me, given this event, there is a high likelihood that they felt threatened, that they are now experiencing nightmares as a result, that they are now experiencing these things, right? Because we're also looking at a level of functioning before that event, right?
Okay.
Because if before that deployment, you were sleeping fine, you were getting along with your partner fine, you were, not having any panic attacks, yet after this you did, there's a correlation there, right?
Okay.
So we're looking at the person's functioning before and after this traumatic event took place. And that's where we're seeing the significant difference.
Okay.
That's what gives us that indication.
Right. Right. Yeah, it does. It does. And I just learned a lot of stuff here just in the last couple of minutes, but it's a lot of information, but I'm glad you explained it, because even, like I say, I talk to so many veterans on a daily basis, and it's just that disconnect of them not understanding some of the basics that you just explained. So definitely, I'm pretty sure a lot of other veterans that's going to see this on my YouTube channel would definitely appreciate it. So again, Dr. Garcia, I appreciate you taking the time. I know you're a very busy man. Definitely appreciate you taking the time to do this interview. Thank you for your service. Thank you for servicing veterans as well. And I'm definitely, I'm pretty sure your clients, other veterans will appreciate it as well.
Thank you, Dwayne. I appreciate you for having me. I appreciate all the work that you're out there doing, advocating for all of these veterans that, right, like our country's heroes, man. They all these men and women who have gone out there and put their lives on the line to ensure our freedom and to ensure that, we have the luxuries that we do, and we need to be doing our part for them. I do want to say one last piece, and I think this is really, really pivotal. Oftentimes, very often, right? And think about your days in the military. A lot of the message that we received was like, hey, suck it up, pull yourself up by the bootstraps. There's no time for this emotional stuff. And so one of the things I've seen, Dwayne, is a lot of folks that have come back, veterans that are struggling with PTSD, but don't know it's PTSD. They'll tell you, yeah, I have nightmares. Yeah, I get agitated a lot. I'm always frustrated. Yeah, I don't like going places anymore. Yeah, me and my partner broke up because we're constantly arguing. Or I just feel like I don't want to be around people. Or when I go out, I'm on edge. Like, those aren't specifically criteria in the DSM, but that doesn't mean that those aren't indicators of something that might be going on that's deeper. And so what I tell veterans is if something in your life feels like it's a struggle, like you ain't sleeping well, or your relationships are shifting, or you're just more irritable, or you're losing your temper, that can be something that if we investigate a little bit deeper might be PTSD, right? But we're so used to being like, it's fine. I'll get over it. I'll be fine.
Right.
Let's not do that to ourselves anymore. Let's get the help that we need. We got wonderful people like you out here, helping vets. And so,
appreciate it.
To all the veterans out there, don't stuff this stuff down. Don't hide from it. Come and get the help. It's, when we could get that help and that support from, man, things feel different, right?
Yeah, most definitely. Most definitely. Yeah. I agree. So thanks again. And I'll say thanks on behalf of my subscribers, because I'm pretty sure that they'll find this interview very getting tongue tied, very beneficial. Okay.
Awesome. Thanks.
All right. Thank you, Dr. Garcia. Have a good one.
Be well.
Okay, bye.